So I have a speed presentation for you. I have one slide. Maybe I have a couple more slides than that. But I'm Lisa Heral. I am on the board of the Fibrous Dysplasia Foundation. I'm also the Registry Planning Coordinator for the Fibrous Dysplasia Foundation. And I'm here today really to introduce two other speakers because I want to share some exciting news with you guys today about a new partnership that we're forging with the National Organization of Rare Disorders, NORD. So, really, I think I'm just going to ask Deanna Portero to come forward. And thank you, Deanna. Deanna came very last minute to talk to you about this new partnership and this new opportunity that's being offered to the Fibrous Dysplasia Foundation to bring about a patient registry. And she's going to tell you a little bit about what a registry is and what it can do for our population. And then Amanda Konradi is going to come and also add to the conversation, and then if there's some time left, I might say a few words after that. So let's get you.
So let me see if I can get the notes for you, because I kind of
Okay.
get a few of my thoughts over there. Guess where I look. All right. So no notes, guys. My name is Deanna Portero. I'm here with the National Organization for Rare Disorders, and I'm so excited to be here with you. NORD is a 501c3 nonprofit, just like the Fibrous Dysplasia Foundation, and we were founded a little over 30 years ago to address the cross-rare disease issues faced by the 30 million Americans with rare diseases. So the definition of a rare disease in America is any disease with a population, with an American population of 200,000 or less. We were founded when a group of patient advocates in the early 80s really rocked the boat and essentially got a landmark piece of legislation passed called the Orphan Drug Act. And the Orphan Drug Act incentivized greatly a number of tax incentives and marketing incentives for pharmaceutical companies so that they would be more likely to start to develop treatments and bring treatments to market that were already developed in rare disease. So that's our founder, Abby Myers there, and the rest is kind of history. So registries and rare disease. What's a registry? What's a natural history study? And why are registries important in rare disease? Registries, I mean, I'm sure that you're thinking wedding registry, or maybe you're not. I'm not sure. That's definitely the only place I've heard about it before starting to work in this space. And a registry can mean a lot of different things, and it means different things to different people. And I'm here to maybe clear up some of that confusion. So a lot of the time when you hear the word registry, it's going to mean something as simple as almost a sign-up form. Like here, this is my name, this is my contact information, I have this diagnosis, please just reach out to me with news. It's a registration process. Registries can be far more sophisticated than that. So a lot of the initial kind of conversion, these are the symptoms that were characterized in those first 4 case studies that got published, moving to a more fully phenotyped disease where we actually understand the constellation of symptoms in that disorder. That can happen through turning those anecdotes into data, asking people more comprehensively, are you experiencing this, are you experiencing that, and you can start to get a cross-sectional study. So kind of ask everyone a series of questions once and get a better set of information about the community that you're working with. A natural history study is a study that embarks upon trying to find the natural course of a disease over time. So understanding without intervention or with the typical interventions, what's the course of the disease? How fast does it progress? What are the most common things that happen at what time? As you guys have seen already in some of the presentations that have been given by the fabulous folks at the NIH, there's been a lot of really important natural history work that's already been undertaken. but registries can also be utilized to, in a very cost-effective way, and I'm talking about digital, hosted, kind of web-based registries where you're just signing up and providing information. They can be used to gather information longitudinally, so checking back in on a regular basis to really path the course. Because there's so many different stories. Definitely in this community, just being here, I have already learned so much about how different this disease is for everyone, and in order to have a really, and not even one disease, several diseases, but there's so many stories, and this entire community stories is to map all of those, not just to understand the different ways that the disease might manifest. So why they're so important for rare diseases in particular is there's significant evidence that they help improve care. For example, at this very simplest, you can start mapping the most central outcomes for patients and start noticing whether the preferred outcomes are occurring around which care centers. So identifying those centers of excellence, identifying which doctors are doing great things, which hospital environments are doing great things and putting great care teams together. You can also improve care in terms of identifying which treatments across centers of excellence really are producing great outcomes. And we have a board member, Marshall Summer, who actually works with Allison right now at Children's National Medical Center. And he put together a registry for urea cycle disorder, or a set of disorders pertaining to urea cycle. And just in virtue of getting additional information through this urea cycle registry, Marshall was able, in a particular cohort or a particular community, raise the 5-year approval rate for a certain rare disease from the mid-60s to the high 90s, just in virtue of saying, what are people doing, what are the treatments that are being issued, and what are the associated outcomes, and finding the best, finding the sterling, and then starting to apply that. So applying information as quickly as we can gather it. They also increase efficiency in research efforts. So when we talk about saving money, when we talk about making every dollar count, every dollar spent on recruiting is a dollar that maybe didn't need to happen when we know that there's a lot of people who really want to participate in research and willing to supply information about their characterization thus far and want to be reached out to. So whether you're talking about in basic and translational research or clinical trials, there's kind of creating a place for the community to gather and creating a way for us to structure it in a structured fashion, give information about what's going on in our lives. We can actually increase the efficiency of research efforts. This also gives a great starting point for a lot of researchers who are all going to have the same basic questions about whatever sample they ultimately receive. It allows for the data that you supply to be reused over a series of research studies, rather than every single time you might want to participate in a research study, you need to provide that information over and over and over and over again. We also see that this supports the development of treatments. So in terms of, there's a lot of ways that patient input and caregiver input and family input can support the development of treatments, but not least helping define the endpoints that matter, just the outcomes that you are asking questions about, the questions that you have at the tip of your tongue, whether that's figuring out for who and in what situation contouring leads to good versus not great results. Those questions are actually pinpointing what the pharmaceutical companies, what the bio companies need to act, what the manufacturing companies, like device manufacturing companies, need to pay attention to, because those are the only outcomes that matter. Because the ones that matter to you are the only ones that matter. So it helps identify those endpoints. It also helps reduce risk participation in registries for the enormous companies that would need to be bringing their buildings of researchers and millions of dollars for them to know this patient community is organized. This patient community, I can distribute information easily. The characterization of this disease is good, and if we needed to get more information, there's a group of people who are around and willing to answer questions. These are all things that from the business point of view on the pharma bio device manufacturing side make a really big difference to them and make them more likely to pay attention to this community. So that's super exciting, right? Right? Yes. Okay. Yeah. That all. I mean, and not. Yeah. And I definitely, I'm here as a complete ally to everyone in this room, and I don't want to say that every single one of those would happen or will happen next year. It's a longitudinal project. Take time. Maybe not all of them will come to pass, but these kinds of projects, this is the spectrum of really great things that can come from them. So at first, NORD kind of started out with just thought leadership. So we worked together with sort of the international European rare disease group, and we worked with the Canadian group, and we just kind of started outlining what registry should be doing, what registry providers should be, what the sort of principles behind these programs and initiatives should look like, so that we kind of identified a lot of ways that you could really easily go wrong, or things that don't ultimately benefit patients as much or as quickly. Believe it or not, no one was listening. People were trying in some cases, but it's difficult to come up, when you know exactly kind of what should be happening and you don't see it happening. Eventually, you get kind of pushed to the edge, and we decided to jump in ourselves. So we now provide direct support to rare disease patient organizations, and that involves giving them the technology to engage in these projects, so the technology platform required to engage in these kinds of projects, but also the mentoring and the support from just having someone on the other end of the phone to talk about, what the data access committee should look like and how the nominating process should go for that. So what we believe is empower the community, empower the community, empower the community. We believe that without going into too much detail, there were a lot of registry initiatives that were cropping up that would let patient communities pull together these registries and even have some input on the data model, and then not have, some of them let you have input on the data model, some of them would let you ask the questions that you actually cared about and make it clear what questions you want answered. But a lot of them were not doing that, and a lot of them were not actually, were centralizing the way that the data who would make decisions about who could contact whom, or who could share what information in what kind of way and what kind of context. So we kind of scrapped that model and said, hey, it's really clear that there's these, we are a membership organization, which means that we have members who are patient foundations primarily, and also individuals. So we believe in empowering that contingency.
And you're doing good without your notes, but I just wanted to let you know that your bullet points are here if you want reminders.
Oh, okay, thank you. Thank you.
I'm not going to hit all your highlights.
That's true. You can tell me, if you raise your hand, if you're like, oh, Deanna, I wish you had said that.
No, you're doing fine. You know it in and out.
So we're really actually pushed into taking a greater role in some ways by our friends at the FDA and NIH, who saw what could be happening here it's ignored. It's not really getting there yet. We really believe in this model, but no one's really bringing it to fruition, so please will you step in. So I am very much, I don't know if you noticed my first slide, there's no letters after my name. We have a very stakeholder-centric approach, so we make sure that we listen. We don't know everything at NORD, but we make sure that we know at least one of everyone, you know? So it's kind of the Noah's Ark of advisory sort of situations. Talking to nurses, physicians, patients, caregivers, technologists, talking to people in the various agencies, not even beyond FDA and NIH. And what we ultimately aspire to, these are like kind of two buckets. A, create a safe, centralized, reusable platform for the people that we serve. And then also establish the guidelines and best practices for the design and execution of these projects. So when it comes to the platform, I just want to just double, triple, underline safe. We employ a defense in-depth security model, and it's a encryption-based security model, and it's military-grade encryption. So there's 3 layers at least, depending on what kind of data you're looking at, of military-grade encryption. So we very much, just in virtue of the kinds of people that, and the different kinds of diseases that we are targeting, are really aware of how sensitive this information is. So it's a very safe platform. That's something that we definitely thought was priority. That's a question. All right, so we had a pilot this year. We worked with the Von Hippel-Lindau Alliance, which is a multi-system disease, and they had a very, very complex data model. So they've well over 1,000 questions actually in here, although no patient actually answers 1,000. The way that it works, they have a very rigorous branching logic, so they'll kind of get drilled down until you can't provide any information on anything. So let's say, like if you, for example, answer that you're, female, your first one, that knocks out, 200 questions, because they're not going to ask you, like you have ruled yourself out of, 200 questions about prostate health. All right, so it's still mainly patient-reported, and it's really centric around patient-reported outcomes right now and patient-reported data, whether that's that doesn't include files that patients might have on hand and caregivers might have on hand. So we do have questions that support upload, so you can upload files, but right now it's still mainly patients driving the bank, so to speak. We listened, and I'm going to speed through. I know that we don't have a lot of time, unfortunately. We're out of time. Yeah.
Okay, we're out of time. No, go ahead.
But we just wanted to make sure that we had a streamlined registration process where you can, from the get-go, outline your contact preferences. And knowing we also allow for you to respond on behalf of, let's say your children. Multiple, it's essentially account management based, so that you don't have to juggle a million logins. Branching logic, like we said, show hide, only see questions that matter to you and pertinent to you. Validation, if you write you were born in 1796 instead of 1976, it'll catch you. It's like, are you sure? We don't think so. And it supports things like drafts. So these are just basic features that we're listening to people and saying, how is this going to fit into your life? How can we make it fit into your life better? Things like 2 weeks ago implementing, if you get logged out in the middle, there's a timed log out so that you stay logged in a public computer, you can't access it. Well, now there's the opportunity to retrieve the work without having it, you had it saved. Just because, every step that we make toward making this fit into your life, the more that you guys can achieve with it. Mobile responsibly designed, so if you want to use your tablet, your phone, it will fit the screen that you're looking at, no pinch and zoom, and instant feedback. So after a certain amount of people have answered a set of questions, then you will be able to see the results to that after you've provided your own answers. And that's of joint privacy and also serves like research design kind of. Thank goodness for the researchers who had said, don't show them the graph before they give the data. All So plans for the future is accommodating more clinical data with less data entry. So we're looking into options for allowing for patients and caregivers to give HIPAA authorization so that coordinators can go ahead then and just request the appropriate medical records. You don't have to go chasing them down. Have an eye open to blue button integration in the long run, which blue button integration being the federal government is pretty much forcing the entire medical world's hand into adopting electronic health records that can be shared between hospitals. So at a certain point, once they get their act together, we're immediately going to hook into that and start pulling that information in here again so that we can facilitate more research, so we can empower more researchers, so we can answer more questions. Multiple language support, and of course, whatever we hear from you. There's something with a cane coming.
I'm so really gathered that we had you give so much information in such a short time. Thank you so much for coming last minute. It's very exciting. And I want Dr. Konradi, who's also on the board of the Fibrous Dysplasia Foundation, to put this in terms of what this really means to us personally. This tells us about the platform and what they're going to offer electronically, and I'd like Amanda to share a little bit of her story. Okay.
My email's here, and I hope that if you have any questions about anything, just send them to me.
And next time we're going to allow you a lot longer. I promise.
Yeah, we actually will not have time for questions after I finish speaking, but we will be here at dinner time, and we'll be back here tomorrow. Lisa and I are happy to talk to everybody about this if you want to. So I'm just going to read this so I can speed right through it, but I'm going to hit some key points. So members of my family have Cherubism, and in 1998 my brother tracked down researchers who were trying to identify the gene that causes Cherubism. And he found a group in Boston, and he found a group in the UK, and my family gave blood, my family swabbed our mouths, and we sent it off. Then later I was at a conference with the FDF Foundation, and a researcher wandered over to our table, and he said, I was kind of looking for some people with Cherubism. And I said, wow, you're lucky. And so then I gave blood, my children gave blood, and then we were involved in that research. Then we had the scientific conference in 2010, and I met another researcher, and last summer he took a chunk out of my arm. And so, basically, this is not the way research should be done. I mean, you can take some chunk out of my arm, but it's not supposed to be done by personal contact, right? It's not just that we happen to have a very active family and looking for opportunities, okay? So much more could be discovered about FD, MAS, and Cherubism if there was a way to concentrate the information about patients and their caregiving families in one place. The registry will create a pool of FD, MAS patient data, broad in expression, that will allow us to see patterns about the disease and its treatment that have not previously been recognized, and help investigators seek out willing subjects to improve diagnostic techniques and develop medical interventions. So what the FD registry is. The FD Foundation registry will be a pool of data about patients and their families controlled by the foundation. It will consist of whatever the FD Foundation and its members think is important to track. It will begin as a set of patient-reported outcomes. It will probably grow to encompass clinical information, and hopefully in the future will be connected to a biobank, where tissue and blood is stored to make it available to researchers. The registry will allow the FD Foundation to issue annual reports to you. The registry will enable researchers considering a particular issue to access patient member data in de-identified form to figure out whether there might be a pool to do a study. The registry will also allow researchers to post information about studies, enabling patients who want to participate in them to make contact. The development of the backbone of the registry is in process. Lisa's been working on a number of things. Right now, we also have a review of the literature to identify the key patient outcomes in process. Matthew Morawski at Purdue University is working with a set of graduate students, reviewing the literature, identifying domains, identifying patient-reported outcomes, and measures for those. Begin to compile this work. This list will be shared with the registry working group, made up of clinicians and investigators, and then it will be piloted with a group of FD patients from this group. It will be modified as necessary to become the backbone of the registry. Clinical investigators working on FD and MAS, who are members of the scientific and medical advisory councils of the foundation, will be asked for their input to develop a list of desired clinical data that could augment the patient-reported outcomes. So related surveys will be conducted by this organization to ensure the scope of the patient-reported outcomes address all patient concerns. These will be advertised on the FD Foundation website, the Google group, Facebook page, and hopefully you will transmit that information to other people. As the registry goes online, the FD Foundation will solicit information about ongoing or planned studies to advertise to patients. So now it comes to the big thing. How can you help get the registry up and running to improve the quality of diagnosis and treatment? 1, we need a group of FD-MAS patients and caregivers of young children to help with the piloting process. This will entail answering a long list of patient-reported outcomes measures that's being generated, right? So we need to start with the big list so we can refine it. And we need some of you to say, I'm willing to sit there for an hour and a half and answer these questions to help us with that. Okay, we need FD and MAS patients to participate in the additional surveys to make sure that your concerns are covered. So this would be a survey about, what are your issues? Obviously, pain is going to be a key one, but there's always an issue that comes up, like pregnancy, how might this matter? Things like this, we need to hear it. So we need people who are willing to do that. We need you all to become members of the registry. I mean, that's very basic. We need you to sign on once we've got it and commit to answer the background questions 1 time a year. And we're ultimately going to need patients and families to help raise funds to keep the registry in operation for the long haul. So, without further ado.